Heart disease, also known as cardiovascular disease, refers to a group of medical conditions that affect the heart and blood vessels. It is one of the leading causes of death worldwide and encompasses a range of conditions such as coronary artery disease, heart failure, arrhythmias, and valvular heart disease. Coronary artery disease is the most common form of the heart disease and occurs when the blood vessels that supply the heart muscle with blood and oxygen become narrowed or blocked. This can lead to chest pain or discomfort known as angina or heart attack if the blood flow is completely blocked. Heart failure occurs when the heart is unable to pump enough blood to meet the body's needs. This can cause symptoms such as shortness of breath, fatigue, and swelling in the legs and ankles. Arrhythmias are abnormalities in the heart's rhythm, which can cause the heart to beat too fast, too slow, or irregular. This can lead to symptoms such as dizziness, fainting, and shortness of breath. Valvular heart disease occurs when the heart valves become damaged or diseased, leading to problems with the flow of blood through the heart. This can cause symptoms such as fatigue, shortness of breath, and swelling in the ankles. Heart disease is often caused by a combination of genetic and lifestyle factors, including high blood pressure, high cholesterol, smoking, obesity, diabetes, and lack of physical activity. Treatment options for heart disease vary depending on the specific condition and can include lifestyle changes, medication, and surgical procedures. Heart disease is a condition that can be prevented through a combination of healthy diet and regular exercise. Here are some tips on how to prevent heart disease through diet and exercise for both adults and kids. For adults, follow a healthy diet. A healthy diet is rich in fruits, vegetables, whole grains, lean protein, and healthy fats. Avoid processed foods, sugary drinks, and food high in saturated and trans fat. Limit salt intake. High levels of salt can increase blood pressure and increase the risk of heart disease. Aim to consume less than 2,300 milligrams of sodium per day. Maintain a healthy weight. Obesity is a significant risk factor for heart disease. Aim to maintain a healthy weight by exercising regular and following a healthy diet. Get regular exercise. Aim to exercise at least 150 minutes per week. This can be achieved through a combination of cardiovascular exercise, such as walking, jogging, or cycling, and strength training such as weightlifting or yoga. Quit smoking. Smoking is a major risk factor for heart disease. Quitting smoking can reduce the risk of heart disease and other health problems. And tips for kids. Encourage healthy eating. Provide a variety of fruits, vegetables, whole grains, and lean protein to your kids. Limit the intake of sugary drinks and processed foods. Limit screen time. Encourage kids to engage in physical activity instead of spending long hours in front of screens. Encourage physical activity. Kids should engage in at least 60 minutes of physical activity every day. Encourage activities such as playing outside, cycling, or playing sports. Promote a healthy weight. Encourage kids to maintain a healthy weight by eating healthy and staying active. Be a role model. Set a good example for your kids by following a healthy diet and staying active yourself.